No matter how well you clean your face, chances are you feel that your skin is dull and dry. And professional exfoliating your skin can bring it back to life. Joining me now is Dr. Therese Stubbs from Therese Aesthetic Medicine to discuss ways to bring back that glow. Dr. Ann, nice to see you again.
Good to see you too.
We are going to discuss peels, which is really interesting to me because we have now different types of peels.
Exactly.
And they work differently, and they work differently for different people. So what are the types we're talking about?
Basically, a peel is anything that will take off the top couple layers of your skin. So you have the epidermis on top, the dermis on the bottom, and then there's this thin layer called the stratum corneum on top. Big word for just the top layer of kind of dead skin cells. Anything that peels that top little layer off will freshen the skin because your new skin cells come to the surface. So there's chemical ways to do that. There's mechanical ways like microdermabrasion, and then there's lasers that do that too. So they all go different depths and do different things. And depending on what somebody's looking to achieve, these peels just peel away that top layer of dead skins, and certain things may clear pigment, some may just brighten the skin. So it depends on what you're trying to achieve.
But all of them are considered safe.
Exactly.
For anybody.
And different skin types, certain darker skin types, you might not be able to go as deep as quickly, say with a laser. Lasers can promote hyperpigmentation or increase in pigment in darker skin types. So somebody with Asian skin, Indian skin, African American skin, we go a little bit slower with the laser or a little less depth. So you might be able to do a series of peels in a smaller depth. But someone with Caucasian skin, someone with very, very fair skin, light eyes, that's a person who's amenable to a very, very deep laser peel and might be able to get the same result with one fell swoop rather than multiple peels.
Okay, let's talk first about chemical.
Chemical peels are very popular in the spa setting. Just as you talked about earlier, someone goes on a hotel vacation and they might go to a local spa and get just a light chemical peel that might take just 1 or 2 microns off the top. That could be a glycolic acid, sometimes lactic acids. So we can mix different acids together to get different results. Sometimes you can put a chemical in there that lightens the pigment too.
That was amazing to me in this before and after.
Yes,
and you could do that chemically.
A light chemical peel, and she might only be red for a day when she leaves the spa or a medical office.
So the downtime on that is minimal.
Minimal, and then there's chemical peels that go a little bit deeper, but this gal that you're seeing right here had just a very low level peel that cleared some of her pigment, just brightened her skin, made her pores even look a little bit smaller.
Okay, microdermabrasion.
Microdermabrasion is a actual mechanical taking away the top layer of the skin. Most microdermabrasion machines work with little sand crystals that kind of power away or kind of power wash the skin. Another popular one is Silkpeel. Silkpeel is kind of a diamond bit that exfoliates the top couple layers of skin, and that can go a little bit deeper, maybe taking away some acne scars and some pigment there. And so we're seeing a picture right here of somebody with some pitting and some acne scarring, and that's a very deep microdermabrasion peel.
And that's a wonderful result as well.
It is.
And the last one then, microlaser, which you say is probably the newest.
Well, laser peels are kind of the newest thing to hit since, chemical peels have been done for years and years, and the lasers keep advancing every year. The technology gets better and better. And this before and after picture that we're seeing right now is called a microlaser peel. She had a pretty deep peel, this gal, because she wanted some tightening under her eyes. She wanted some tightening around the lips, the perioral line where you can get sometimes what people call smoker's lines, but people get them who are not even smokers, just those little vertical lines. And this gal here, you also see just the little vertical lines around her lips that a lot of women hate. Some people call them lipstick lines, smoker's lines, but we did a very deep peel right around just her mouth, and so she can even out those little divots or little lines right around the mouth.
So this one is deeper, and you can see that it takes away more wrinkles.
Yes.
Topical wrinkles, and tightening too. I didn't know that.
Yes. Anytime you deliver heat to the skin, you're going to affect a little bit of tightening. So what heat does is it goes down to the lower level in the dermis, and it stimulates your own fibroblasts to make more collagen. And collagen is always good. We always love more collagen in the skin. It gives you that tightening and kind of that. So lasers have that added benefit of giving you the tightening and the smaller pores too. Chemicals don't provide that heat. So chemical peels can actually exfoliate the top. They can take some pigment away, but they don't have the heat element that lasers do. So we often tell patients, just come in and tell us what you're looking to achieve, and we can kind of recommend which peel is best.
Makes sense.
But even the people who just want to take off that little bit of summer sun damage, just even a light chemical peel can do real well with that.
Dr. Ann, I feel educated. I knew I would.
Thank you. Well, thanks for having me.